Hello everyone. Today we are going to discuss about one condition that is called worm infestation. So this worm infestation will be coming under gastrointestinal infection. So let's see one by one regarding what is worm infestation and their description of worm infestation. So before starting the introductions or before starting description of worm infestation, let's see the different term that we use for the worm infestation. So in another term, we used to call it as a helminthic infestation or the helminthiasis. So helminthiasis or the helminthic infestation, it is usually occur in the children, and the main causes for this infestation is that ineffective disposal of the human excreta. So means the infected person is not properly disposing the human excreta, especially the stool, in the proper place. Okay, so because of that, contamination to the soil or contamination to the water may lead to spreading to the other children. Let's see the definition of the helminthiasis or the worm infestation. So worm infestation is a microparasitic disease which occur because of the parasitic worm that will enter in our body, and they are going to accumulate it in a body part, especially the gastrointestinal part, and the child is going to get infected. Okay, so that is called worm infection. Now we are going to discuss about the causes for the worm infestation. First one is ineffective disposal of the human excreta. So human excreta, especially the stool, so if they are not passing in the uh, proper place, okay, so instead of passing in the proper place, the infected person will dispose their excreta in the open field, or because of that, what happened, it is going to be contaminated to the soil and the water. Okay, so if someone is drinking or touching the contaminated water or the soil, leads to spreading of this infection. And next one is poor environment sanitation. The surrounding where the child is living should be properly hygienic or clean. If not, the worm may be contaminated to the hands by the children. So without washing the hand again, if the child tries to eat any food or any drink the water, then it may lead the child to develop this worm infestation. And next one is eating mud and playing under the in the mud. So this is commonly occur among the children if they play in the place where it is already contaminated with the human excreta, or already the worm is present. So it may be lead the child to develop this kind of the worm infestation. The next one is consuming of the unwashed vegetables. So next one is contaminated water, consuming of the contaminated water, and next one is infected beef or pork without proper cooking. Some of the worm are there which are going to present especially in the meats of the beef and the pork. Okay, so if we don't cook properly, then the child is going to develop the worm infestation. So these are the causes that we have for the worm infestation. Now we are going to discuss about the types. So first we are going to discuss about the types of the worm that we have. Okay, so we have three types. First one is nematodes, cestode, and then Trematodes. Okay, so these are the main three worm that uh, uh, we have that will lead to helminthiasis in the human. So in the nematodes we have three types. First one is called roundworm, second one is called pinworm, third one is called hookworm. And in the cestode we have tapeworm. And the last one in the trematode we have fishworm or the flukes. So one by one we are going to discuss now. Let's discuss about the worm, sorry, roundworm. So roundworm, it is also called as the ascaris. Okay, so another name of the worm infestation or of roundworm is called as the ascaris. So it is the most common types of the helminthiasis infestation that we have. So where this roundworm is going to be present in our body. So once the roundworm enter in our body, they are going to collect or colonize in the small intestine. Okay, so next let's see what is the length of this worm in male and female. So the measuring or the length of the roundworm is differ from the male and female. Okay, so the female, the measurement is around 20 to 40 centimeter, and for the male it is only 12 to 30 centimeter. Okay, so next we are going to discuss about how much eggs can be produced by one female roundworm. So per day they can produce around 2,40,000 eggs per day if once they enter in our body. So everything, the eggs, all things is going to be accumulated or colonized in the small intestine. The lifespan of the roundworm is around 6 to 12 months, maximum around 1.5 to 2 years. They can live once they enter in our body. The mode of transmission is fecal-oral route. Okay, so fecal-oral route, it is the mode of transmission that we have for the roundworm. So usually by the ingestion of the ineffective eggs which are present in the food, or contaminated food, soil, or drinking, or by the contaminated hands and the fingers. Okay, so this is the mode of transmission that we have. Next we are going to discuss about the incubation period. The incubation period is around 2 months. 2 months is the incubation period for the roundworm. Now we are going to discuss about the life cycles. I told you that it is going to be the main common causes that coming from the ineffective disposal of the excreta, human excreta. So now what happens is anyone who is already infected with this worm, they are going to dispose the human excreta in an inappropriate way. This leads to contaminate to the soils or water or anything. So now we are going to discuss about life cycle first regarding contamination of the soil. So now the egg is going to present in the soil. So after that, what happens, this egg is going to be present in the soil as in the form of the unfertilized egg. Okay, so after few weeks, what happens, they are going to become a fertilized egg and an ineffective larva. So now they are ready. Once they, if they entered in our body, they are ready to get the infection. So what happened next, the child is going to ingest any food which is contaminated with the ineffective larva. Okay, or drinking of contaminated water, or using hands which are contaminated with the ineffective uh, larva. So now the child is directly going to the infective larva will directly go inside the body. Okay, and then what happens is they once then this worm is going to be reach the duodenum. Once they reach the duodenum, what happens, mean they are going to activate, and they have a quality to penetrate in the wall. They are going to penetrate the wall of the duodenum, and they are going to go to the bloods. Okay, so after this, next cycle is that once they go inside the blood directly, they are going to go inside the lungs. Okay, so they are going to migrate into the lungs from they are going to migrate into the lungs. So once they enter into the lungs, the child is going to start coughing. So when the child start coughing, the worm also going to go out from the lungs. Okay, and they it is going to be swallowed into the into the stomach and the small intestine. Okay, finally what happens, the worm is going to be present in the small intestine. So in the small intestine, many eggs is going to be produced by the female worms, and the egg is going to be transmit, or it is going to be passed out from the body along with the stool. Okay, so this is the life cycle. If again this the patient infected person is going to, again if the person is passing stool in the open field, okay, so it may lead to contamination of the soil and water, and the same cycle will be coming. Okay, so this is the life cycle of the roundworm. Now we are going to discuss about the pinworm. So pinworm by name you can also understand. Pinworm means what? Pin means very small, very minor. Okay, so pinworm is also called as a thread worm. You can see in this picture they look very small and a thread like structure. Okay, So it's also most commonly occur among the infants and the children. So where they are going to live? They are going to live in the appendix, cecum, ileum, ascending colon of the intestine. So when we see the length of this pinworm, it is only 1 centimeter long. And let's see how much female pinworm can be produced. Means they can produce around 16,000 eggs per day. Okay. And next one is the lifespan. The lifespan is only 20 days. So only 20 days they can live in our body. Once 20 days, then they are going to die. Okay. So that is the lifespan of the pinworm that we have. Now we are going to discuss about the life cycle. So in this also usually fecal-oral route only. So especially the child is going to be ingest the particular egg, maybe by using the contaminated hands with this egg. Okay, or maybe because of the drinking or taking of the food which are already contaminated with the impregnated egg. So what happened means, so now the baby is touching the fingers. In this life cycle, the finger which is contaminated with the egg, the baby is touching into the mouth, and it leads to the entry of the particular larva. So now the larva will be going, larva is going to go inside the intestine. So in the intestine, where it is going to develop, they are going to develop in the mucosa level of the intestine. Okay, so where they are going to penetrate and development in the mucosa of the small intestine and the upper colon. Okay, so in that they are going to develop and they are going to become mature in that part. Okay, so they are going to they are going to become more mature in the that. Okay, so this is the process how they do. So once they will enter into the small intestine, the more they go inside deeply into the small intestine, they are going to become more mature. Okay, so once they reach the upper colon and all, they are going to become more mature. Okay, so now what happens is after that they are going to the gravid worm. Gravid worm is the worm has have a who have the capacity to uh, produce the eggs. Okay, so what happened, this worms is going to be migrated into the rectum. So once they reach the rectum, they are going to start producing the various kind the eggs. Okay, the eggs is going to produce. So during this time what happened, the child is going to get lots of itching. Okay, so the child may be again rub the area, okay, scratch the area. So in the hand already it will be contaminated. So again what happens is the child may use this hand, okay, use this hand for eating or eating food, or the hand may touch to the other children, and it may lead, and this leads to transferring or the spreading of the infection. So this is the life cycle of the pinworm. Next, we are going to discuss about the hookworm. Okay, so hookworm, another name we call it as a encyclostomiasis. Okay, so this is another term that we have. Okay, so hookworm is usually we have two species in India. So first one is called A. duodenale. Okay, next one is N. americanus. So usually we can see this hookworm in both rural and slum area. Okay, so A. duodenale is the hookworm which we can found usually in the North India, and the N. americanus is usually we can see in the South Indian, okay, area. So next, hookworm. So once they entered inside our body, so where they are going to live means usually they are going to colonize in the small intestine, mainly in the jejunum and, okay, jejunum and the remaining attached to the intestinal villi. Next we are going to see about their length. So male worm is around 5 to 11 long, and the female worm is around 9 to 13 long. Okay, so the lifespan of this the lifespan is around 1 to 4 years. Then mode of transmission is due to skin. Okay, skin penetration. So the mode of transmission is it is touching or contacting with the infective larva by the skin. Okay, so that is the mode of transmission that we have. Incubation period. The incubation period is differ for the N. americanus and the duodenal. For N. americanus, it is around 7 weeks, and next for the A. duodenal, it is 5 weeks to 9 weeks. Okay, so this is the incubation period for the worm. Now we are going to discuss about the life cycle of the hookworm. Same thing for this also. The infected person is going to pass the stool in the inappropriate way, inappropriate place, and it leads to contaminate to the plants or the soil and water, whatever it is present. So usually this kind of egg usually going to contaminated in the, going to be present in the blades of the grasses. So they are going to attach like this, and they are going to present. So now what happened is the child is playing in the without any sandals or the shoes. So what happened when they touch this kind of the plant? So this worm is going to directly going to enter into the body through the skin. Okay, they are going to penetrate the skins, and they are going to go inside our body. So once they penetrate into the skins, they will go into the bloodstreams, and they are going to go to the heart and to the lungs. Okay, so usually they are going to go to the lungs capillaries, and from the capillaries again, once they entered into the lungs. Okay, so now already to the bloodstream. From the bloodstream it will go to the lungs. Okay, lungs is the larva is going to enter the lungs capillary. So once it enters, what happens, the child is going to start coughing and all. Then what happened, the larva is going to again migrate upwards towards the trachea, and once they come to the trachea, when the child try to swallow, again with the swallowing process it will enter into the small intestine. Okay, so this is the way how they entered in our body. So in the small intestine, once they reach the small intestine, they will start production of the eggs, and the eggs will be again passing out from our body through the stools. Okay, so this is the life cycle that we have for the hookworm. Next, we are going to discuss about the tapeworm. Okay, so tapeworm is also known as a tiniasis. This is another name. So tapeworm usually we can found we can usually found in the pork or any kind of the beef uh, meat. So in that usually we can found the tapeworm. So lifespans once they entered in our body, so they can live around 22 to 26. Next, we are going to discuss about the mode of transmission. The mode of transmission is because of the consumption of already infected meat. Okay, so consumption of the ineffective and the inappropriately or improperly we are cooking the meat, and they are going to consume by the particular person, and it leads to transmission of the tapeworm. Okay, so next one is ingestion of the unwashed raw vegetable, food, water contaminated with the eggs of this tapeworm. Okay, next one is reinfection by the regurgitation of the eggs from the small intestine. So these are the three mode of transmission that we have. Now we are going to discuss about the life cycle. First, ingestions. Okay, ingestion is going to occur in the body of the child because of the mode of transmission that we have discussed. When they reach the stomach, they are going to develop a scolex. Scolex means it is a types. When this what happens is this, there will be having lots of, there will be development of the various kind of teeth, so that they can suck the blood from the body. Okay, and this is the, with the help of the scolex, the tapeworm is going to be attached to the wall. So when they start attaching to the wall, the sizes are going to increase, and why it is increasing means they are going to suck the blood and nutrients from the body. Okay, and next after that they become the gravid. Gravid means what I told you, that gravid means they are eligible, or they are capability to produce the egg. So once they are capable to produce the egg, during that time they are going to pass or the migrate into the intestine. Okay, and then egg is going to produce, and what happens is this egg is going to be passed out from our body along with the fecal matter. Okay, so this if infected fecal contaminated the pigs, okay, or any cow. So because of that, what happened, the pig is going to get infected. Okay, pig or the cow is going to infected. So this infected pig, the meat of the infected pig or the cow. So if we are taking this injection, then it again leads to the development of the tapeworm infestation. So this is the life cycle of the worm infestation we have. Next we have trematodes. Trematodes commonly with us we can see among the children with who are living in the South America or the Africa. Another name we call as a blood flax also. This is also occur due to the penetration into the skin. So the clinical features that we can see is like acute dermatitis, abdominal distension under pain, nausea, vomiting, and sometimes the eggs can be colonized in the liver, genitourinary tracts. So this is regarding trematodes we have. Next, we are going to discuss about the common clinical manifestation. So in that we can see abdominal pain, nausea, okay, loss of appetite, sleeplessness, irritability, anemia, diarrhea, vomiting, pica. Okay, so these are the conditions that we can see. Next, we are going to discuss about clinical features based on the different types of the worm. So for the roundworm, we can see cough, growth retardation, vitamin deficiency, urticaria, fever. For the pinworm, we can see poor appetite, teeth grinding, enuresis, scratching or itching of the end of the rectum area. Next one is clinical features of the hookworm. We can see black color stool, perverted taste, constipations. For the tapeworm, you can see headache, growth failure. Next, we are going to discuss about a diagnostic test. So we can do history collection, stool examination, blood examination, CSF examinations. Now, complications. In the complication, first one is intestinal obstruction, perforation, jaundice, appendicitis, pancreatitis, ascaris, encephalitis, ascaris, encephalopathy, liver abscess, peritonitis, protein loss, or the quadrico may be developed to the child. Now we're going to discuss about the management for the roundworm. So we can use anti-helminthic medication. So the drug of choice is albendazole, and then mebendazole that we can give for the 3 days, as well as we can give parental pamodes 11 mg per kg. That also we can give for the pinworm. Also we can give albendazole, mebendazole, anti-helminthic medication that we have to give, as well as like hygienic measurements like short nails, hand washing, personal hygiene, sunlight dryness of the infected clothes, antibiotic creams you can apply in the pre and perianal area. Next one for the hookworm, which is same only, and helminthic medication treatment of the anemia, oral iron therapy, blood transfusion can be done. Next one for the tapeworm, also same, albendazole, mebendazole, praziquantel, or the niclosamide. You can give this all treatment for the 30 days, then baby will be fine. Next one for the trematode, and we can give anti-helminthic. Now we are going to discuss about the preventive measures that we can do to prevent from the worm infestation. For the roundworm, to prevent from the roundworm, so first thing that we can do is disposal of the human excreta in the proper place. Okay, next one is reduction of the fecal contamination of the soil, that we can throw the proper human excreta in the proper place, or the child, we can ask the child or any person to pass the human excreta in a proper place. And next one is provision of the safe drinking water. Make sure the drinking water should be safe. We can boil the water before drinking. Otherwise, make sure the water which is coming from should be it should be away from the contamination. And next one is food hygiene. So before cooking, we have to clean properly, we have to wash properly. Before eating any vegetables or fruits, we have to wash properly. Okay, next one is good personal hygiene. So good personal hygiene is very important. So before eating and after eating, or that the child should do proper hand washing. Next one is improving habit of the hand washing before and after defecation also should be done by the child. And next one, as much as possible we have to avoid, okay, we have to educate the community or the children to prevent from the open field defecations. Okay, so these are the preventive measures that we have for the round. Next, we are going to discuss about the preventive measures of the pinworm. So for that, same thing. For this also, personal hygiene should be maintained. Careful hand washing. So before defecation or the before any eating of any meal or any food, the child should go for hand washing with water and soap. Okay. The next one is nails should be cut. We have to cut very shortly so that the worms should not go inside the nail and then present there. The next one is clean the nail with the soap and water, or you can use any old toothbrush and then the child can clean the nails. And next one is see if in the family members anyone is having infected by the pinworm, so all the persons should be treated, not only one. Okay, so we have to focus on all the treatments to be given to all the family members. And next one is we can ask the child to wear any tight pants or any kind of tight clothes. Next one is the clothes which are used by the infected child or the family members should laundry. We have to do very careful laundry for them, okay, properly. And next one, we are going to discuss about the preventive measure of the hookworm. So in this simple things for this also habit of improving the personal hygiene. Okay, so personal hygiene like hand washing before and after defecation, before and after eating of the food. So these all things kind of the personal hygiene should be maintained. And next one is as much as possible we are going to ask the child to wear the footwear and then go for playing or the roaming in the places. Okay, so next one is use of sanitary latrine or the proper disposal of the fecal matter should be done to prevent from the contamination of the soil water. Okay, next one is changing of the farming practice. So what happened is the farmer used to use this kind of the raw fecal materials for treating the as a fertilizer for the plant. So we have to change the farming practice, like we can use other fertilizations or so before using the raw feces or the fecal matter, the farmers should check whether the uh, animals is having any kind of infection or not. Okay, so after that only the fecal matter should be used by the farmer. And next one we can let's discuss about the preventive measure of the tapeworm. So for this meat inspection, so now in the market there is having lots of shop, they are selling the meat, so there should be an inspection of all the meats whether the tapeworm is coming present or not in the particular meat. And next one is proper cooking. So whenever we consume the meat we have to be properly cook it. Okay, so next one, a proper sewage treatment, okay, disposal of the fecal matter in the proper area.